While many of us do not live or are on the Bloomington campus, my Colloquium committee members and I still wish to acknowledge and honor the Mia Amaki, the Lenape, the Bod We Wad Meek, and the Sawanwa, whose ancestral homelands and resources Indiana University is built on. This event could not truly happen without the co-sponsorship of the African Studies program and the Center for Research on Race and Ethnicity in Society. Your support is greatly appreciated, and I hope for future collaborations and a fellowship that will endure. Lastly, I'd like to thank our own department, the Department of Folklore and Ethnomusicology, for the support and participation in COCOM events. It is with great pleasure that I get to introduce my folklore colleague, Dr. Anika Wilson, to the IU campus via Zoom. Dr. Wilson is the chair of the Department of African and African Diaspora Studies at University of Wisconsin-Milwaukee. She earned a PhD in Folklore and Folklife Studies at the University of Pennsylvania, and her research and teaching focuses on gender, narrative, and spirituality in Southern Africa. Her book, Folklore, Gender, and AIDS in Malawi, No Secret Under the Sun, was awarded the Elli Kongas Maranda Award for Feminist Scholarship in Folklore. Dr. Wilson is currently working on 2 research projects. One involves the analysis of legends and beliefs related to sacred sites in Central and Southern Africa, as they are linked to ideas about spirituality, religion, and ecology. Her other project examines the nature of argumentation and representation of gender expectations in divorce court transcripts from Malawi. So at this moment, I would like you to please give a warm welcome to our guest, Dr. Anika Wilson.
Hi, everybody. I want to, for a second, see everybody all at once before I go into, all right, let me see if I can see everyone. All right, it's very strange. I can't look out across the room to talk to you all. So I'm scrolling to see everyone, but thank you so much for inviting me to give this talk. It has been like a long time in the making. I think I was originally, you were going to invite me last year.
No, it was 2017. The first time I checked my email. The first time
2017.
I invited you was 2017, and it's finally coming together. So
all time and space collapses for me. But yeah, so it's finally come to pass, and yeah, I couldn't be more grateful to talk to folklore colleagues and Africanist colleagues and whoever else is on this call. I don't know who all is here and who you're representing, but I'm just so pleased to be here, and I really look forward to the conversation that we're going to have that follows. I don't know if I'm going to do the whole 55, 60 minutes, because I'm really also eager to hear what you guys have to say and what your questions are. So what I'm going to talk about today is entitled Going Viral: How Social Media Has Transformed Disease-Related Conspiracy Theories in Southern Africa. I like the way that the title sounds way more definitive than any type of analysis that I've done so far. But the reality is this is an emerging research for me. It wasn't even on the list of things that I sent to Fernando of things that I'm researching now. And so I guess a little background is in how I came to this project is my previous research. I also did a little work on conspiracy theory around HIV/AIDS in Malawi. So Malawi is a small country, and some say Southern and some say Central Africa, depending on what type of, you know, are you talking about ethnic group affinity, or are you talking about political and economic networks? But whatever, that's of no importance. So the research I did, I talked about conspiracy theories and how they were linked to history. And I didn't really have any inclination to do any further research about conspiracy theories. But then COVID conspiracy theories started popping up sort of the latter part of 2020 and earlier this year. So that sort of, I said, okay, I can't help but compare the conspiracy theories that I learned about and analyzed in the past to what's coming to be now, because I saw some continuities, and I also saw some really startling differences that in some ways I think are a little bit easy to account for, but I'd like to discuss it anyway and hear you guys' take on it. I don't know how many people here do research on, I see Diane Goldstein in here, but I don't know who all does research on conspiracy narratives and health or health-related ideas. So let's just get started. Let's see if the advancing of slides works. Where's my cursor? Okay. All right, so this is basically the abstract. I think you guys all saw this in the advertisement, but this is just a repeat of what I said. So essentially, I want to see the evolution. My question is, how have conspiracy rumors about health evolved? What is the evolution? So one of the interesting things I think you can do if you look at conspiracy narratives about health is that you can track changes in ideas and concerns and fears. So in a sense, these are a little bit like snapshots. I haven't consistently been tracking this, but looking at different points, you can see snapshots of the way that ideas are evolving and emerging, which is not to say that old ideas are given up when new ones come along, but that there's like a growth and a development of these different ideas. All right. And these are sort of the main places where if you want to see what I've written about this before, you can find that. I don't know if you guys are interested in seeing these slides later, but I can move through these. The first one, I did research where I worked with people in Malawi who were also sort of my informants and who wrote about when they heard various types of rumors and conspiracies emerge around AIDS and AIDS treatment. And I ended up doing research particularly about the treatment of AIDS because around 2004, 2005 is when you see a rollout of AIDS treatment. But later in the early 20-teens, we also have, I was also present in Malawi when another rumor emerged, which was about a new type of disease called Imputsi, which didn't turn out to be a real thing. But by listening to the rumors, you could see the way that ideas about HIV/AIDS had developed over time. So I'm seeing this as almost like another snapshot about where you see developing ideas on disease and disease treatment and responsibility around those types of things. All right. So my research questions are essentially, what can we learn about the nature of unfolding conspiracy theories around COVID-19 in Southern Africa by tracking related social media postings? And so I come to this because this is where I heard about it. I am not in Malawi now, even though I was supposed to travel there last summer. For some reason that didn't happen. And so social media postings become a way for me to ascertain what the concerns are. What are the conspiracy theories that are emerging now, right? This is a bit of a contrast also to the methods I used previously, where those were orally transmitted narratives about conspiracies about HIV/AIDS. And so another question is, again, how do these compare to conspiracies of the past epidemics or pandemics? And what types of means or ideas circulating transnationally are accelerated through these social media networks? So not just what do we find here, but how do they relate to, and here is a strange word to talk about when you're talking about social media, but where is the here? But how do the memes that we find circulating in Southern Africa or even continentally compare to the ones that we see accelerated in other networks elsewhere? So these are some of the questions I have. I don't by any means answer. I start to get to answering these questions, but again, this is early stages of this research. There's some kind of typo in there for my cutting and pasting, but essentially part of the reason this is important is because rumors and conspiracy theories can have an impact on how people receive health messages and public health campaigns, right? How people react to when people come to town and they say they're going to do vaccinations, whether they feel that they should comply or not comply. This is a very public health terms, comply or not comply to health recommendations that are given by governments, or especially in the case of countries in sub-Saharan Africa, non-governmental organizations and other agencies that have in some way taken the place of what government structures do in other countries. Actually, I guess in that way, we're not that different, because things that government structures do in other countries, we have private interests taken care of here, such as, you know, infrastructure for energy, but that's another story. All right, conspiracy narratives. So I don't know if everyone is here is a folklorist. I don't know if so not everybody's a folklorist, so all right. So I'm glad I didn't make assumptions. I think we have common sense ideas about what conspiracy theories are, and I think in a lot of ways, those aren't too far off from some of the definitions that we use, like within, that are more technical within the field. But what you see in conspiracy narratives, most people would call them conspiracy theories, but some folks want to call them conspiracy narratives. But what you see is a borrowing from sort of past collective narratives and experience to account for things that are troubling, phenomenon that people see that don't make sense to them. These conspiracy theories or conspiracy narratives help people to make sense of things that are either feel something's not right, or it is inexplicable, or we're not getting enough information, or the source of information that we have cannot be wholly trusted, right? So if there are those kinds of concerns, there's a gap of information or a gap of trust between the disseminator of information, then you're going to find that this is a setting for conspiracy narratives to bloom. And so conspiracy narratives are, I would say, a type of a rumor, but more specifically, conspiracy theories suggest that in reality there are powerful individuals or groups or corporations that are able to operate in secret ways to manipulate the outcomes of major circumstances in people's lives, right? So whether it's in politics, or whether it's in health, or whether it's the economy, the idea that there are these powerful people, and they're not just, you know, right out in the open about it, right? That there's secrecy to it, that they're manipulating things behind closed doors for their own ends. And so this is kind of what I think makes conspiracy theory unique from just like the generic idea of rumor, which is that a lot of times it focuses on these shadowy organizations, or even like individuals that are well known, but maybe doing things in a kind of secretive way, like they're doing something else. So you'll see later that Bill Gates becomes a big lightning rod for concern in the current COVID-19 pandemic. I have to say, it's very weird for me just to talk this long, because I'm used to teaching and having like a back and forth. So we'll see how this goes. All right, so just to say a few more things about the idea of conspiracy theories, is that some scholars shy away from just using the idea of conspiracy theory, because the terminology, when it's used in popular culture, tends to stigmatize people who spread these theories. Just something, the term seems to be linked to like, oh, those kooks, those, you know, paranoids, people are just believing nonsensical things, which I think can make people tend to dismiss the grounds on which people have built their concerns, right? The grounds on which these narratives are built are important to understand. So if we just dismiss people out of hand for as, you know, fringe, or, I mean, I think there was like a whole television show named Fringe, but anyways, that's besides the point. But, you know, there's an idea that there are these people who are out of the mainstream, who are pushing problematic narratives. All right, so the important thing, I think, though, for folklorists to study is, well, one of the important things are, how do we use these narratives to understand where these concerns came from? What are the grounds on which they're built, right? Because that's important if you're going to have any communication about what those conspiracy theories are, right? So we also see that there are power differentials that are discussed in scholarship around conspiracy theories. So a lot of times people will suggest that these conspiracy theories are abundant in particular communities because these communities feel themselves to be manipulated or disempowered in various ways. So that could be ethnically, regionally, nationally, socioeconomically. Through a marginalized group, that might be a place where that chronic disadvantage may lead to conspiracy theories. This is not totally the case, though. I don't think that is like a supportable idea. That is just disadvantaged or marginalized groups that have conspiracy theories. But I think that among communities that feel themselves disempowered, I think that we do find conspiracy theories thriving in sometimes. But I want us to think about conspiracy theories not as just people who are disadvantaged blaming the powerful, right? Because my research has shown it's about more than just a blame game. And so I'm going to go through that a little bit more, but I wanted to bring that up at the beginning because I think one of the things that it can be easy to fall into is thinking that people are just pointing fingers. But I found a much more nuanced way that conspiracy theorists, people who were sharing conspiracy narratives in Malawi, were actually talking about responsibility and accountability, right? Not just you did this, you are to blame, right? There was a lot of discussion around the conspiracies that were being shared that we need to identify who's responsible, not only for creating the problem, but for solving the problem, and find a way to hold those people accountable to fix the problem, right? So a little different than like, oh, this is the China disease type situation, the Wuhan disease, finger pointing, or this is a foreigner disease has come to destroy us, right? That there's I find more going on than that. All right, so actually I feel like that is I feel like that should be in a different place. So let me just skip that one and come back to it, that slide. So I want to stop here to talk a little bit about what were some of the conspiracy theories that I found prevalent when doing research between 2014 and 2013 in Malawi. And so there were a number of rumors and conspiracies around HIV/AIDS and also the treatment of HIV/AIDS. And by looking at those and reading those over and over, I found that they fell into this kind of pattern of a few things. And I specifically ended up thinking about treatment because, you know, there was around the time between 2004 to 2005 was around the time where we started seeing the government roll out a plan for antiretrovirus ARV treatment. So this is basically like a free treatment program for people who had a certain viral load of HIV. All right, so one of the main narratives coming out was that ARVs are only for rich people. That's one. And I'm going to talk about these a little bit further in upcoming slides. So ARVs are only for rich people was one. And this is a particular theory or idea that was coming out of a time before the rollout of the free viral medicine. So this is a little bit before the rollout. The ARVs are only for rich people. And then two, AIDS industry rumor, which kind of cuts across before and after the treatments become available. And the two-tier drug system, which continued, which, I mean, I would say it existed before ARV rollout, but you see after ARV rollout, it became a very prominent, thread of conversation that was taking place around antiretroviral treatments. All right. So ARVs are only for rich people. So this particular conspiracy theory mostly talked about how there were rich countries that had created diseases that would kill poor people or people in poor countries. And there were, I didn't show you all the quotes because that's just too much reading for everybody. But there were a number of people who talked about how, yes, there is medicine to treat HIV, AIDS, especially symptomatic AIDS. But the only people who can afford these medicines are people who live in rich countries. So sometimes people will bring up folks like Magic Johnson or something like that, or people would talk about how AIDS had essentially become, and this is like around, if you're thinking about 2004, right? There's places in the world where AIDS had already become kind of a chronic disease instead of an acute disease that killed you quickly because of people having access to antiretroviral medicines. All right, so some of the rumors said essentially that the disease was created to kill poor people because they knew poor people would never be able to afford these medicines. And then another sort of discussion on top of that reinforced that idea was the knowledge that this wasn't a medicine that you only took one time, right? That if you started taking this medicine, or if you wanted to take this medicine and live, you had to continuously take this medicine, right? You could not stop, or you would, the viral load would raise and you would find yourself progressing toward death quickly again, right? So how could people who are poor, who live in a poor country, and Malawi is a country that, in terms of wealth, is for very low ranking in the world. How could poor people in a poor country ever even conceive of the idea of taking a medicine that is not only expensive, but you have to keep taking it? And that was seen as sort of more fuel on the fire as to why this disease was created by rich people to kill poor people. And I didn't include any of these quotes here, but there were people who were saying things like, this is a way for the rich countries to stop having poor countries begging donations from them or something like that. And that was something that was articulated by some people. So an interesting thing about this thread of conversation, though, this thread of rumor, is that there is not a rejection of the salience, right, or the way that the efficacy of ARVs, right? There's an acceptance of the idea that ARVs work. So it's not a rejection of the medicine as not working. It's a concern of how could we as poor people ever get it, and then linked to this conspiracy theory. Yeah, and here's just a quote from a local individual in Malawi who, all this is anonymized. I think if it was a heavy problem in the white country, they could have already found a cure for the disease at this point. And you can see that they want to provide the life-prolonging drugs. They're selling them at a higher price. So it can only be bought by those people who are rich, which means there's no chance for the poor people to have something to help them to overcome this disease. And then they talk about how expensive they are, and how can a poor person buy such a thing. All right. The second set of rumors we see a lot is the AIDS industry rumor. And this is a set of discourse that discusses the ways that local, national, regional, international, governmental, NGOs, private foundations, all of these different groups are actually profit seeking in terms of HIV and AIDS, right? So there's the idea that AIDS is in fact a kind of an industry, that there's money that flows for those who are involved in working in the AIDS industry in one way or the other. There's an interesting thing that people would talk about healthcare workers who would go to seminars or meetings, and they would get some funding, and they would go to hotels, and they would just be enjoying themselves and drinking beer and womanizing, all off of AIDS money, right? And so people would talk about, why would anyone want AIDS to stop when there are these people who are essentially making a living and having sort of access to things they wouldn't ever otherwise have access to because of AIDS. You get to go and travel, and you get to go to seminars, and you get to go stay at nice hotels. And some of this is relative to like what a nice hotel is, but just, just escaping the everyday because you are part of the AIDS industry. And the higher you are up the chain in government or NGO, right, the more perks you get from being involved in this AIDS industry. And so there's this idea that's being put forth that people were actually not trying to stop AIDS, trying to help people with AIDS, but they're just trying to profit from this industry. And another thing that sort of supported this was that in the media, whether you're talking about, I'm talking about not social media at this point, but I'm talking about newspapers or radio, and particularly radio was, in this period was a very prominent means for getting information from places like the government. You saw that there was a lot of coverage about how much money the government or various NGOs were getting from AIDS donors, whether it's like the Global Fund, things like that. There was, and they would quote the amount of money that were coming in. I didn't share that with you guys. So here's a quote from another journal. I better check my time. Okay, start moving right along. Anyway, so you can skim this if you want to, but essentially this is someone who is talking about how AIDS had been around for 20 years already, and people could see how much money was being pumped. Kwachas are the money used in Malawi, the currency, or Malawian kwachas. Billions and billions of kwacha are going towards this disease to assist people who are already infected in different ways. The government might think it's the best way to assist them. Now they have these ARVs, and the government is selling them. Where do you think the huge amount of money different organizations gave to government has gone, right? So, sorry, there's some like typos from my cut and paste. So essentially people are saying, this is before the medicines were free. Why are we paying for these ARVs when the government has been given so much money to help to treat this disease? After all, we haven't seen any other benefits coming out of this money, right? Out of this money that's been flowing into this country for decades, right? And this one also has an example of the idea of people just enjoying themselves from AIDS money. What they know is just using the money on their daily needs, like going to resort, club, motel, hotel. I don't really see those as daily needs, but okay. With their families, leaving the patients out there in agony. Right. And a lot of these things aren't just a lot of these rumors are about or talk about a global imbalance of power and wealth very explicitly. So in another journal, someone talks about how some old man said that in a country like Malawi, which depends on asking assistance from other countries, it becomes rich when it finds support or funds from other countries in terms of the AIDS crisis. And so then he talks about by having the high report of people suffering from AIDS and sending those reports to donor countries, the rich people in these countries and those governments and Malawi leaders are able to get even richer, right? By proving that there's a problem by this accounting of illness. So this speaks to concerns that people express, which was that essentially, if they go to a government clinic for medical care, their blood would be taken, and there would be a test to see if they were HIV positive, but they wouldn't be given the result of the test. They'd be secretly tested, and that would be that their number would be added to some kind of database, and then their number would be used for that organization or the government or whoever to now get more money, and then they don't see any benefit from that transaction, from that blood test, right? They neither get to know the results or get any kind of funding or care out of that. So this was something that people complained about as well, right? Blood was tested, but they don't know why. It's all about the AIDS industry. All right, and so the third type or categorization, I'm not really trying to do the law of threes. It's just a coincidence that the rumors that I saw sorted into threes. At least I think it's a coincidence. Maybe subconsciously I'm doing the law of threes. I don't know. Oops, I'm trying to move here, but I realized that there's a dog at my feet. All right. So the two-tier drug system was another set of rumors, or related set of rumors, where people were asking the question, once the ARVs started rolling out, why are the drugs here so cheap or free? And so one of the answers that people came up with is that there are two types of ARVs, one for the rich countries and one for poor countries like Malawi. They say they give the strong, i.e. good medicine to people in rich countries and weak to people in poor countries like Malawi. And I wanted to step back from that and kind of ask the question of what are the experiential or historical factors that lead to people coming to conclusions like this, right? Because if conspiracy rumors are grounded in previous experiences or narratives that are already existent in a population, then what are some of those narratives or what are those experiences that help lead to these concerns? And so I was able to find in the literature a few things that are suggestive of what sort of the groundwork or the foundation was for some of the HIV/AIDS rumors. And one was in the 1930s, there was a syphilis campaign. So this is a sort of colonial period type campaign to vaccinate people with syphilis. And they found that people rejected it. They said that the vaccine was making people sick, so that we were not going to take that. But there was also another thing that happened, which was that there were, in fact, two types of treatments. So there was an older treatment for syphilis. I think it involves some kind of arsenic as part of the ingredient for the treatment. But a newer treatment came along that was being used in the West. And then at the same time, people like in Malawi were still receiving this older treatment, which was also, had arsenic or other types of detrimental aspects to it, right? So this is some of the experience, and this is some of the issues from past campaigns. Similarly, in the 1960s, there was concern about the smallpox vaccine campaign. There were rumors circulating that the vaccine caused sterility and death. And this has rolled into ongoing concerns about population or population control efforts of the West to depopulate Africa or control the population of Africa through sterilization campaigns and things like that. And we know that there have been issues related to also testing, using quote unquote virgin populations to test vaccines and things like that. So all of these things roll into the groundwork for the emerging rumors. I didn't get them all on there. To organize this better the next time I give this talk. Excuse me. This is why I got my ginger tea ready. All right. Right. So I think that on one hand, it's not that hard to track some of the places where concerns arise for people that help to create the groundwork for these conspiracy theories. But that doesn't always help people to have nuance about what conspiracy theory is about. I think there's like just a tendency to be like, oh, these people are poor, or, which is again, not the case. Not everybody who speaks a conspiracy theory is poor. Or they're ignorant, again, or uneducated, again, which is not also something that we should espouse or support. Or that it's just a blame game, right? Because I found that if you look at the discourse around these conspiracy theories and you don't just separate out the theory from the conversation, then you see that it's a lot more complex. There's a lot more nuance to that. I'm going to get to that, but now I feel like I am backtracking. All right. So I want to talk about the idea of not just a geography of blame, but a rhetoric of accountability. So some people who have studied rumors about diseases, like thinking the medical anthropologist, Paul Farmer, have talked about things like, thinking Sabatier talked about there being a kind of thing like a geography of blame when it comes to disease rumors. So people are saying like, oh, it's the Haitians, that's where AIDS is coming from. Or we see in the case of COVID, people wanting to say Wuhan or China, whatever. So it's easy to dismiss those as like, this is just a, it's easy to dismiss that finger pointing as just like, this is just a blame game. But I think that if you look further into the discourse, you can sometimes find something that is not just a geography of blame or finger pointing, but people really asking or looking for accountability and action, right? And this is what I found. So I want to take it back a little bit because I want to talk about some of the circumstances that are relevant to Malawi, but also just more generally in Africa. There was a sort of colonial and post-colonial or neo-colonial histories that help to create an atmosphere where people aren't just blaming, but they're looking for accountability. And so you have people like Bayard writing about something called the politics of the belly, right? Which is a type of politics that some analysts have seen I don't know how to say this. Some people who observe and analyze African governments in the post-colonial period would say that, right after the well, not right after the post-colonial period, but not long after the transition to independent governments, which some people might put in quotes because of continuing ties. But there came to be among some countries something called the politics of the belly, where elites would hoard wealth at the expense of the poor. Funds for government programs were subverted into the hands of particular elites who were in the position to take advantage of that. And this is by some called the politics of the belly because of the idea of this consumption that happens. And then you have structural adjustment programs. So I don't know how, I don't know what people know about structural adjustment programs, which is where how shall I say this? A structural adjustment program is essentially a type of loan with a whole set of clauses to it about what the receiver must do, right? And so countries that became, who had debt or needed more cash flowing in, ended up being part of structural adjustment programs from the International Monetary Fund or World Bank. And the strings that were attached to taking these funds were that their government had to be reorganized in such a way that the government itself shrunk. So all of those agencies where people were working, such as it could be energy, infrastructure, it could be education, politics, had to go from more centralized to devolved to smaller districts and things like that. So the essentially structural adjustment programs shrunk government, and many of the governmental functions that were replaced by non-governmental organizations. And they also had to open their doors to the nations that took, or countries that took on this structural adjustment debt, also had to open themselves to free trade with certain Western countries, all these things like that. They had to open their doors to non-governmental organizations. And in some ways that led to the end of certain types of government structures where you might have, in Malawi, for example, there was for a long time a president, he called himself President for Life, Kamuzu Banda, and the structural adjustment program helped to usher him out in some ways because the way the government had to now open up and change and shift because of the strings attached to these fundings. And all of this is coinciding with the ideas of transparency and accountability, which are required by non-governmental organizations, structural adjustment programs themselves. All of these new sort of rhetorics were entering in. It was sort of like a short, mini lecture on that. So essentially, I'm linking this idea of these transitions toward having a government which is partly government and partly governed by these organizations that aren't strictly government, and the push for transparency and accountability that is part of those, as part of the reason why you see people not just blaming, but also incorporating a language of, okay, we can't tell what's going on. There's no transparency, right? We don't know what's happening to that money that the country or that the government is consistently saying that they're getting on these news reports, right? Where's the accountability for what happened to that money? Where's the transparency in where that money is going? So all of this is to say that by pointing to a concern with the government, pointing to concern with some NGOs, is not just a game of blaming, but really takes on that rhetoric of accountability, right? So it's more than a blame game, is what I want to say. I almost want to stop and hear what you guys are thinking. I can't read faces too well. All right. So that was some of my main takeaways in that project. And so when I started hearing rumors about COVID, at first I was like, I'll just leave it alone. But then I couldn't help myself but to start doing some analysis, because I was just, at first I was shocked by how different the rumors were. But then as I looked a little further, I could see there were actually a lot of continuity. So I want to talk, so here I'm just, in this section, I just want to compare and contrast. It's very simple level analysis, just compare and contrast a little bit about the types of rumors that are emerging, especially around treatment. The previous research was also around treatment, so it's kind of a good symmetry there. Yeah, so mostly around treatment and how people are receiving and talking about treatment. So if you look at this chart here, you could see that this is actually a chart of COVID rates in Malawi and how they grew. So there was like a long time where there was not anything significant going on in terms of COVID rates. I would hear from people and they were like, we don't know what you're talking about. Nothing is happening here. It's fine. We're not having a problem. And then you see toward the end of the year, especially into December, that rates went up. People started seeing folks getting sick and die. There was sudden need for lockdown and masks and other things like that. But this was also happening at the same time that we had the announced rollout of vaccines for COVID as well. Okay. So what are some of the main rumors that I've seen so far? So let me just say that this is not at this point like a systematic research project. At this point, it is, I have contacts who are on various WhatsApp networks, and I said, what are the WhatsApp things that are being not WhatsApp, what are the materials that are being forwarded that you're getting related to COVID? So I need to, what I'm working on now is figure out how to do a kind of snowball sampling for that. If there are people who have a lot of good experience on the digital humanities, slide into my DMs and let me know, whatever it is. But yeah, so this is something I have to work on figuring out. But I've taken what I've got so far to think about like the content of them and how the content of these compare to the earlier rumor cycles. So I don't know, I did threes again, so maybe I am doing the laws of three, I don't know. All right, but first, one of the big things that popped out to me was these Bill Gates depopulation rumor cycle. I just call it the Bill Gates because he was a figure that was named most frequently, but again, I'm not doing like a frequency study because I don't have the kind of systematic data in order to do that kind of thing. But Bill Gates was a named figure, whereas others were sort of more shadowy. And the Bill Gates depopulation rumor cycle also included a couple of other elements to it, right? So it incorporates within it like this concern with an invented disease, right? A concern with these like global figures or major organizations. Right? There's also, I'll show you later a little bit more talk on like the IMF or the International Monetary Fund, that really stands for this, or the World Health Organization, those letters really stand for that, right? So there are these major figures from the global north who are inventing the disease or accelerating the disease and spreading it to African people specifically. So that was one set of rumors. Another related, all of these are somewhat related, which is that these vaccines and COVID will help to usher in a new world order, and that the end of the world will come because through forced vaccinations, people will be forced to get vaccinated and show a certificate that they were vaccinated in order to be able to buy and sell things. And this comes from Revelation in the Bible, and that essentially I'm sure some of you guys have heard all these rumors before, that essentially that the vaccine is like the mark of the beast. And then once you have that mark, you'll be able to buy and sell, but then you'll be irredeemable and your soul will be lost. And you will also become an antichrist. And that there's also a link between coronavirus and 5G. All of these things fold into each other. And that there are African elites who are colluding with people in the global north, like Bill Gates. Actually, this should go under its own thing. I'll rework that. And this is about the coming end of history. And then there's the two-tier drug system, which is almost basically the same as what we saw in the HIV/AIDS rumors previously. All right, so this is really different for me because I never really done research much on things related to the internet, because once the day is done, I don't want to go and look at internet rumors. But anyway, so I put some memes, or do these call memes? I don't know. These are just images that were forwarded many times. The interesting thing is if you have WhatsApp, sometimes it will be like forwarded, and then sometimes it will say forwarded many times. So some of these are forwarded many times. And you can see in the one image that there is a newspaper, The Sovereign Independent. Does anyone know this paper? I've never heard of it. That talks about depopulation through forced vaccination, the zero carbon solution, and has an image of Bill Gates. And then in a separate forward, there was this doctored image of the Bill and Melinda Gates Foundation. And it says the Center for Global Human Population Reduction, sort of leaning into the whole population reduction narrative. And here's Bill Gates making a deal that will unleash death to Black people through the vaccine. Again, Bill and Melinda Gates Foundation. Hell is unleashed, the deal is sealed. So that collusion issue. And then a text essentially, which says that Melinda is warning everybody that this is a disease that will harm everyone, like the fake Ebola vaccine that killed 1 million innocent children. That is why I no longer want to live with a bloodthirsty person, whatever his money. Share this around the world. So, okay, I put those, but I don't want to create the impression that those were like that. No one is disputing these, right? Because, you know, this is not one of the disputers, right? This is another person who, again, the president, I don't know where this comes from. I think the Tanzanian president did reject the COVID as a thing and the vaccine as well. I don't know where his stance is right now, but that was something certainly that happened. I don't know if this particular quote is correct. I have to go double check it. But this was an image that circulated on WhatsApp. but besides figures like the president, a president of Tanzania, which can be like a very problematic when you have someone who is a head of state, essentially telling people that disease doesn't exist, who has regional influence. You also have a lot of preachers, like there were videos being sent around on, especially like, well, I can't say especially on religious WhatsApp groups, but on religious WhatsApp groups, you did have videos of preachers talking about this new world order that was going to be ushered in, and that this was going to come because everyone has to get an ID and everyone has to get a vaccine, and that's going to be the mark of the beast. And I'm talking really fast because there was just a lot to these things. And that all of this is linked to 5G, which is a way people are going to track you. And this will usher in the new world order and bring about the Great Tribulation, which is a sort of trouble at the end of days. And the people who don't have this mark will be, if anybody who knows about sort of interpretations of Christian eschatology, will say, then the people will get raptured who did not have this mark. And everyone else who does get this mark / vaccine will be consigned to hell on earth, and then essentially hell on hell later. So yeah, there were numerous videos of that type. I think, yeah, this is also talking about, I should have put this earlier, the Bill and Melinda Gates and the, what do they call it? Collusion with African leaders. And this was something that also circulated in Malawian social media. I saw it on Facebook, and then someone sent it to me on WhatsApp as well. Just, it's interesting that it's a image from people in Texas will not take the mark of the beast. Presumably, who knows what's doctored and what's not. And what's being said is essentially the place where the vaccine, the place where the vaccine was made, you find people refusing it. So should we be accepting this? Or it's not exact translation. So again, the concern with like the end of days type issues. All right. Nobody's going to read this, but there's a really complicated, explanation by one of these videos from a preacher who's doing this numerology and explains how COVID means 666. You will get lost in the explanation, and then in the end it says, this is simple and straightforward and well understood. That's just my favorite part though, because I did not find it simple. But essentially people are looking for hidden signs. All right, my time is coming near. Okay, finally, in terms of the two-tier drug system, we see a reemergence of the concern about having inferior drugs being peddled to African countries or poor countries. But the word Africa is used, right? So a lot of times in these rumors, it's not like, oh, they're doing this to Malawians or they're doing this. And sometimes this guy, he did talk about Zambia, but people move between thinking of their state national identity to sort of like continental identity or global positioning of Africa and African countries. So this particular person, I don't know who they are, but the forward, the video said this was a Dr. Nevers Mumba, someone, I need to look up some of these people as I'm developing this further. But in the forward, he talks about, the forwarded video, he talks about, we are poor, but we are not stupid. We can read when they write on the vaccine, this is not for distribution in the United States, and this cannot be used in the European Union. They're even telling you that this is not for us because they've got some other substandard stuff that they made for us. How do we know that the injection that was given to President Biden is the same vaccine that is coming here? You didn't check it when they put it on him. You have not compared the vaccine to the vaccine you have received. You can watch it on CNN and even say, President Biden has got a dosage of it. Are you sure? Did you see it? Did you get the drop and analyze that it's the same drop getting into an African's body? I think we need to be more responsible, and our salvation outside of God will be by responsible governments on the continent of Africa. Corrupt governments, those who are just looking for money from the West, are going to kill people like fools. All right, so so there's both a concern about the substandard drugs, right? So and then tied to the idea of collusion with Western governments, who are collusion by African governments with Western governments to dose people with medicine that is not as good as what people are getting in the West. You see there are other forwards that are kind of push back on these narratives. There's people who are saying, be careful to wash your hands and wear a mask and observe social distance. And this is like a figure of a preacher. And then you have a governmental official saying, I got COVID, but it's curable, I'm doing well, do the things that you have to do and you'll be fine. Keep a distance from people, etc. Right, so I just wanted to add that as a counterweight. It's not that all the narratives are the same. All right, so as time is running out, I want to talk about just a few things I observed, which is the continuing concern for depopulation schemes, the idea that that the West has reasons to want the African, sort of maybe Malthusian discourse or whatever, wants African countries to have a suppressed population sizes. So that is a continued theme over that we see over from the AIDS rumor cycles. We also have this concern about inferior drugs, right? A two-tier drugs, again, this sort of like global inequality being highlighted as well. Continuing concerns with corruption and collusion among elites, and this call for responsibility and accountability. All of these I would see as some of the holdovers from the previous rumor cycles. Some of the things that I don't remember seeing at all previously were this concern about end times and Christian eschatology, marks of the beast, rapture, tribulation. All of those things seem to be not as prevalent in the HIV/AIDS cycle, but I'll go back and look and see if I missed anything in my previous research. And I'm trying to think about why do we see some of these differences? And again, this is all very preliminary, so lots of caveats around this. So if we're talking about the grounds for the groundwork or the foundations for new rumors, we have to think about what's considered plausible, or what are the grounds for plausibility. And so we would have to say, I'd have to ask, so what has the growth of evangelical and Pentecostal denominations have to do with this? And what do the transnational linkages in these religious affiliations have to do with the creating the grounds for plausibility, but also like the networks and the means for the movement of information? I also want to think about the sort of prominence or growing prominence of various regional charismatic prophets and preachers and apostles, and what influence these particular figures may have in accelerating narratives through networks, right? or people attributing things to them. But, you know, we do actually have videos of certain people, certain people teaching some of these conspiracy narratives. Obviously, one of the bigger differences is that in the research, while I was doing research earlier, WhatsApp, and I think WhatsApp is like really bigger in this part of the world than even Facebook or other places, due to people's greater access to WhatsApp. And a lot of people still don't, you know, only use things like this like on their phone. They can use WhatsApp on their phone. But this is something that's new. So this growth has allowed for the connection with more narratives from, for different narratives that are originating outside of the region to make their way into regional rumor cycles and, you know, social media networks. There's also related to this are the religious chat groups on WhatsApp. I'd have to find out more if these things were going through other types of WhatsApp groups or just friend groups or something like that. Some other research, I can't remember who the name was. I would close this slide down and open up another thing to tell you who that was. But other research has talked about how certain celebrities making statements, and those statements being disseminated on social media help to popularize certain types of rumor about COVID and in relation to 5G around the world, and into certain networks in Africa. So we saw Nigeria and various places, certain new, I don't want to say news networks, that's not quite the right word. Well, certain WhatsApp networks sort of picking up, and Facebook networks picking up on these celebrity voices, even from the US, with 5G/COVID rumors, and how then that gets reinterpreted in new context. So that's some of the other things I want to talk about. I'll skip that and go forward. That I see that even though rumors can move through different networks, as they're recirculating, they're recontextualized as well. And I need to figure out how to learn more about how things are recontextualized as they're moving between different networks. I also want to think more about how, you know, I want to think outside of the way we do in the US in terms of, you know, this set of people are wedded to anti-vaccine or, you know, COVID denial, while this group of people aren't, and how that has become, in our context, related to sort of party affiliations. And if you're looking at a context where they don't have those same party affiliations, are these the same types of, what would you call it? Is there the same type of loyalty to those discourses if they don't come along with some of those, you know, affiliations and things like that? And I think the other thing I want to think about is not assuming that these rumors are going to have a long-lasting impact. I think they'll definitely reemerge, but I have questions about their duration and strength. So even if they accelerate pretty quickly as amazing news and interesting news, how, I don't know, how strong are they, right? Because another example of some research I did, I found that there was a rumor about a disease that ended up not really existing, but it spread quickly and people were scared for a brief moment and there were a lot of stories around it. But people very quickly saw like, oh, it's not a thing, you know, and abandoned it and moved on to the next thing. And that was just over. And so there's a question about like, I'm not saying that these rumors can't have impacts, but I also want to think about that, like the duration or the depth of the impact in some ways, right? Can impact be sort of superficial? So that's something I would try to figure out. And also thinking about like the impact of interventions. There are places, there are people or organizations that are purposefully making interventions like, no, well, we're going to fight this rumor by putting another type of information out on these networks instead as a counter to that. And yeah, I mean, just thinking about the extent to which, how does skepticism translate to rejection of treatment or not? And I don't know if I can really answer that with the type of research I hope to do, but it's something I'm interested in. So I at least hope to speak to conversations about that. Like, what is the skepticism really about? So those are just some thoughts I had. I'm still ruminating on this whole thing right now. So yes, I can't say I have conclusions, but I definitely think that one of the new things that we see is, oh, hold on, my niece is coming. I have my 18-year-old niece is visiting me, and she has strange hours. So yeah, I think that one of the main differences I see is the impact of sort of like transnational affinities related to religious groups and religious narratives that I don't remember seeing as strongly in the earlier rumor cycles. So yes, and definitely social media has helped to create that change, but not just social media. So that's all I have to say about that. Yeah, sorry, I think I went over a little bit, but.
Thank you, Dr. Wilson. I appreciate you taking the time and actually introducing us to this very, very fresh research project that you are engaging in.